In the third planet of solar system, a land of enchantment lies in northeast of the Caribbean Sea called Puerto Rico, where the story of Acosta family started. This is Romeo, married to Anna. They were blessed a son and named him Raphael. On the other hand, this is Felipe, married to Elsa. They were also blessed a daughter and named her Juliet. Unfortunately, Romeo, Anna, and Felipe died on different years. Despite of loss, Raphael met the love of his life, Juliet, and got married. Romeo and Juliet were given two lovely children, Julia, the eldest, and Julio, the youngest. Juliet is a nurse that went to United Kingdom and worked for 4 years. After 4 years, she decided to go to Canada to work as a living caregiver. Juliet goes to church and attends a Catholic Mass with her co-worker Natalie. Weekly, she considers this activity as a ritual. Juliet considers Natalie as one of her closest friends and support system aside from her family. She applied for her permanent residency, and in 2008, her husband, together with their two children, migrated to Canada. After a year of reunification, Juliet was diagnosed with diabetes mellitus type 2. Raphael is the husband of Juliet. He is 55 years old. He used to work as a farmer at the Puerto Rico and currently working as a laborer of the auto parts factory 2 months after they landed in Canada. He was diagnosed of gout arthritis at the age of 45 years old. He's taking medication for gout like allopurinol once a day. Julia is 18 years old and currently studying at Our Lady of Lourdes Catholic School and working as a part-time in one of the fast food chain restaurants. She wants to work while studying at the same time because she felt that her parents' income is only enough for their daily expenses. Julia is very good in her English and math. She prefers to be alone when in school, but she actively participates in their church. Julia is close to her father. She shares lots of things with him about what is happening in her daily activities, but she is distant from her mother and a bit angry towards her since she left her at a young age. Julio is 15 years old who loves to play basketball. He participates actively in their community whenever there are basketball tournaments. He was awarded MVP twice since they came to Canada. He was the one who always gave advice to his older sister whenever she has a problem. At home, he loves to prepare dinner for his parents, for he knows that they are tired from work. Julio also engaged himself in volunteering work in Canada Red Cross whenever he has free time. He is out of school and looking for a job to help his family. Elsa is a 75-year-old who is the mother of Juliet Acosta. She has been in Canada for 2 months via tourist visa. Elsa only speaks Spanish, and the only person who interprets for her is her daughter Juliet. When Elsa feels bored, she misses her chores and recreation activities of planting vegetables and flowers. She was diagnosed with type 2 diabetes 50 years ago.
Diabetes mellitus is a chronic disease that occurs when there is an irregular insulin production or the body is unable to utilize insulin. This disease is considered as one of the most non-communicable diseases that rapidly increases throughout the years. In the Global Report on Diabetes by World Health Organization, 422 million adult populations have diabetes in the year 2014. The estimated prevalent rate of diabetes among Canadians will increase by 44% from 2015 to 2025. The determinants of diabetes are income, social status, biology, genetics, personal health, and gender. Statistics show that low to middle income families has a bigger rate of family members having diabetes compared to high income families. Percentage of women living with diabetes is higher than in men. According to CDA, 80% of immigrants in Canada, such as Hispanics, Asians, South Asians, and Africans, are at higher risk for type 2 diabetes mellitus. Lifestyles such as lack of exercise and unhealthy eating habits can progress the disease. Juliet is the main provider of the family. She works as a PSW 6 days in a week. A few months later, she noticed that she gets tired easily and often experiences headaches. Thinking it was due to stress, Juliet postponed seeing a doctor, and instead, she opted to get some rest. Weeks after, she experienced having blurry visions while working. Finally, she sought some medical help. And during the health interview, Juliet mentioned two major changes she noticed. First, she noticed that she frequently urinates, especially at night. And second, she had an increased thirst and hunger, which she easily associated with the nature of her job, because it requires more energy and movement. The results are in. Her physical exam showed dryness and warmness in her skin, dry mouth, fruity breath, altered reflexes, reduced sensation and vibration on her feet, and hair loss in her toes. Her urinalysis showed presence of protein and increased ketones. Blood test results showed increased glycosylated hemoglobin at 48.3 millimole per liter. All laboratory test results were linked to diabetes. Thus, Juliet was diagnosed with type 2 diabetes mellitus. Juliet could not believe her diagnosis. She thought she had a well-balanced diet, and the only thing that she could relate this from is her family health history, specifically her mom's. Shocked and afraid, she immediately sought a second opinion. But due to her fears, the results were the same. It was a devastating truth that she had to face and accept. She did not even intend for the people around her family, to know and worry. But the diabetes treatment required the entire family's participation and health adjustments for it to be successful. Today, Juliet keeps track of her nutritional intake and regularly self-monitors her blood pressure and glucose level. She also currently takes oral anti-hyperglycemic drugs that she sometimes forgets, and prescription lipid-lowering drugs, as she is a high risk for cardiovascular disease.
It's the nurse's responsibility to demonstrate professional conduct always. Nurse show concern by asking the family how they feel about the illness that the family member has. Listening keenly to them. Show manners, respect, and courtesy, and be polite to pay attention to Juliet and her family. By maintaining eye contact, keeping professional forum, and maintaining decorum. The nurse should also remember not to treat each family member like a children. Allow them enough time to answer questions and do not rush nor interrupt someone while the member of the family is talking. And most importantly, provide privacy as it is included in the delivering of care. Family of origin concerns are frequently addressed as part of individual therapy. 5 therapeutic questions I would like to ask and engage the Acosta family are the following. How is Juliet and her family coping with the new diagnosis? Second, what are their concerns and fears about the new diagnosis? Third, do they know exactly what the condition is? What part of the body it affects and its effects? Fourth, would they all be interested in learning and developing the skills to educate themselves and prevent each other from developing the condition in the future? And lastly, I would like to ask if they are willing to receive counseling or for a social worker to be assigned to them. It is very important that the nurse demonstrate therapeutic communication described by the CNO. This includes addressing the client by the name or title they prefer, listen, understand, and respect the client's values, opinions, needs, and ethno-cultural beliefs, modify communication style as necessary to meet the needs of the client, and lastly, giving the client time and listening to them while avoiding giving immediate advice and diminishing the client's feelings. It is important that the nurse identify family crises, and these are the recommendations that the nurse must use. First, I am pleased to say that the family showed incredible efforts, being supportive and utilizing the community resources and seeking the help they need. Second, I want to thank you guys for trusting in me to tell me your concerns and fears so I could refer the right services. Third, it was a pleasure providing you with the education required to cope and appropriately treat a condition that many people live a comfortable life with once they are aware of what it is. And lastly, I am happy you guys felt relaxed and safe to talk to the social services, physician, and myself, so we could provide help and information that was needed.